listening to what people are saying and then trying to come to solutions together is probably going to be really powerful and very different from a local authority point of view.
I think that'll be a really interesting aspect of the project for the young people as well, to be able to see some of the barriers that exist within mental health services and support.
The project's called Better Services by Design. It's the next stage in our research within user-centred healthcare design. So user-centred healthcare design is a multidisciplinary project bringing together people from design and healthcare, looking at how methods and ways of working, creative techniques which are commonly used in design, and particularly service design, might be used in healthcare settings and social care settings.
The project itself consisted of 9 months of mentoring to our partners, and we were very lucky after a process of recruitment that we ended up with 2 projects that were really committed to working with us. One was a charity organisation called Chili Pep, and they were interested in using some of their expertise but working with a health service provider, which was the IAPT service in Sheffield. And IAPT is the Improving Access to Psychological Therapies team.
The project we're working on is between young people, if we think of Chili Pep as the voice of young people in that sense, around their mental health, and IAPT, and in terms of looking at changing some of the IAPT service to better meet the needs of young people.
The other project was slightly more open. We were approached by Public Health in Doncaster Metropolitan Council. They were keen to increase the overall kind of level of exercise within Doncaster, and they were able to kind of focus this project around a particular geographical feature.
We're trying to take a man-made lake that is quite an attractive area and is quite large, it's about 2.5k all the way round, and we're trying to understand how people can use that to increase physical activity.
So we had these 2 very interesting, diverse projects, and we were able to bring these people together in a series of kind of action learning sets to understand a little bit about design process and design methods, but also get them to share ideas amongst themselves and move through the projects supported by the designers and the design team.
When we've talked to our partners about design, we've used 3 principles. The first is the idea of designing for people, not patients. So this is taking a broader view of people as having needs and values beyond the health service itself. The second principle is designing with people. So this is about co-creating health services with the providers and the users of those services, and that doing so leads to services that both better fit the needs of those people, but also giving those people a stronger voice in the process leads to both transformation in their personal and professional lives. The third principle is designing for innovation. And this is about encouraging people to use the particular ways that designers think and work to explore problems and solutions differently, such as using making as a way of understanding what problems are, and whether there is a different way of thinking about them that might lead to new answers and innovation itself.
One of the challenges we've had is communicating a design process that, if you talk to designers, they'll say is very messy and iterative and kind of goes backwards and forwards and around in a way that's very easy to kind of explain to healthcare professionals who are used to working with models and other ways that have a little bit more structure. And one of the things we came across quite early on was the British Design Council's Double Diamond approach, which has 4 phases: discover, define, develop and deliver. And this has proved very popular with our partners in terms of it being a very clear way of articulating a design approach.
I'm really quite taken by the Double Diamond framework. It feels very comfortable because I like a framework, I like a theory, and I can see where it all sort of fits together.